Some of you may be thinking about treating those unsightly veins in your legs, but are maybe fearful of the treatment. Well, science and technology have made vein treatment a lot less invasive over the years. Dr. John Rossi of Calcaño and Rossi Vein Treatment Center is here along with his patient, Ronald Acri, to explain and kind of ease our concerns about the procedure. Gentlemen, thanks for being with us today. So Dr. Rossi, obviously vein treatment has really come a long way over the years. Can you kind of tell us how maybe years ago you used to treat it and how it's changed?
Yeah, maybe we can walk through some of the technology which has advanced significantly through the years. This is an old vein stripping device, and this came about probably at the turn of the 20th century. And this instrument was passed up through the vein operatively, and then the vein was tied around the outside of it. And then the instrument was literally pulled back through the patient that ripped out an accordion the vein out of the body. Now that procedure had to be done under general anesthetic in the hospital, associated with significant discomfort post-op, obviously. And now technology has really improved significantly. And I think it's important for your vascular surgeon to sort of maintain that knowledge about the advances in technology. This is a venous closure catheter, and about 10 years ago we began to treat veins with non-invasive radiofrequency energy by passing this catheter up the vein to close the vein from the inside. That's probably the bulwark of the vein procedures that we do today. It's a very non-invasive procedure. It takes local anesthetic to numb up the leg, and it basically obliterates the vein from the inside, and then your body absorbs it. So those patients are done in the office under local anesthetic, and they walk out. And again, it's important to have all these things in your repertoire because if your only tool's a hammer, the whole world becomes a nail to you. And as a vascular surgeon, you want to make sure that you can offer specific treatments for specific patients.
That looks really cool.
Yeah, this is actually, and you can see things are getting tinier here. Now we have what's called a Clarivein device, and this is a mechanical chemical ablation device. So this device goes into the vein without any anesthetic at all to numb up the leg, and is threaded up. Yeah, just make a puncture and it goes into the vein, and then a chemical is introduced, and as you do that, this actually scrapes the inside of the vein, and this little instrument spins around, and it occludes the vein as you back the catheter out. So patients who have this done can just have one needle puncture and have the catheter withdrawn, and that closes their veins from the inside, and they walk out and go about their business. Now, Mr. Acri here came in for 2 different vein procedures, and we had to apply the different technologies because of his anatomy. The first time he came in with varicose veins and swelling and discomfort, we closed his vein with a catheter. And then he came back about a year later with what's called Schamberg's purpura, which is a venous rash on his lower leg. And we used the Clarivein device so we didn't have to use heat, because that vein was close to a nerve, so we wanted to close that vein without using any energy at all. And he can tell you how that experience was.
Yeah, tell me, because you seem happy, right?
The greatest thing about the procedure is you can conserve with the doctor and his team, and when it's all through, you get off the litter and you walk home.
Isn't that remarkable?
With no pain, no after effects. And everything is great. It's just, you have no pain at all. And it's the only thing is you get like a little pinch. If you would get a shot for
we can handle that.
Shot. Yeah, we can
handle that. That's no problem. And it's pretty quick.
It is quick. It takes about 30 minutes to 45 minutes for a procedure. And I mean, I think, and new things are coming down the road. You know, there's new procedures probably going to be approved by the FDA in 2015. With actually a venous glue, which goes through a very tiny catheter and will actually glue veins closed from the inside. That will require no anesthetic. And so I think it's important for your vascular surgeon treating your vein disease to be, you know, currently updated and maintain proficiency in all these procedures, because you have to tailor them to this patient's needs.
Can you quickly tell me about the screenings you have coming up?
Yeah, we have a vein screening next Tuesday and Wednesday, the 23rd and 24th, for patients who would like to learn a little bit more about their vein disease and whether they would be a candidate to have anything done. They can certainly come and get educated to that process, and there'll be one of the physicians there to see them and to do a screening.
Perfect. Great opportunity. Gentlemen, thank you so much for being with us. Thanks so much for sharing your experience with us, sir.
Call 888-720-3599.